Diabetes is simple. It means you have too much glucose in your blood. Glucose is sugar from the food you eat. It's your body's main energy source. To get glucose out of the blood and into the cells, your body needs a hormone called insulin. Insulin is made by the pancreas. When you have diabetes, either your body doesn't make enough insulin or your cells stop listening to the insulin that is produced. This keeps blood sugar high, which is dangerous over time and is the defining problem of all types of diabetes. Type 1 diabetes. Type 1 diabetes is an autoimmune disease. This is not caused by lifestyle. It's when your immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin. Because those cells are gone, the body makes little to no insulin at all. Think of it as a factory that's been permanently shut down. People with type 1 need to inject insulin multiple times a day or use an insulin pump just to survive. It usually develops quickly in children and young adults, but it can appear at any age. Type 2 diabetes. Type 2 diabetes is the most common form, making up over 90% of cases. The main problem here is insulin resistance. Your pancreas is still making insulin, sometimes even too much, but your body's cells are ignoring it. It's like having a key that no longer fits the lock. The glucose can't get into the cells, so it builds up in the blood. Over time, the pancreas gets exhausted from overproducing insulin and eventually can't make enough. It is strongly linked to genetics, high body weight, and a sedentary lifestyle, and often develops slowly over many years. Prediabetes. Prediabetes is a critical warning stage. This means your blood glucose levels are higher than normal, but not yet high enough to be diagnosed as full type 2 diabetes. You have some degree of insulin resistance. About 80% of people with prediabetes don't know they have it. This stage is crucial because it's reversible. With changes to diet, exercise, and weight loss, many people can bring their blood sugar back into the healthy range and prevent type 2 diabetes from ever developing. Gestational diabetes. Gestational diabetes only happens during pregnancy. Hormones produced by the placenta during pregnancy can block the action of the mother's insulin, leading to insulin resistance. This causes high blood sugar. It usually appears in the middle to late stages of pregnancy. In most cases, it completely disappears after the baby is born. However, women who have had it are at a much higher risk of developing type 2 diabetes later in life, and the baby is also at an increased risk. Type 3 diabetes. Type 3 diabetes is not an official medical term yet, but it's a concept linking Alzheimer's disease to insulin resistance. The brain needs glucose for fuel, and insulin is necessary for brain cells to use that glucose. In Alzheimer's, researchers have found that the brain develops a severe form of insulin resistance. This means the brain cells are starved of energy, which leads to the inflammation and damage characteristic of Alzheimer's plaques and tangles. The idea suggests that Alzheimer's is, in essence, a diabetes of the brain. Secondary diabetes. Secondary diabetes is a form of diabetes caused by a distinct underlying medical condition, surgery, or medication. It's not type 1 or type 2. For example, conditions that damage the pancreas, like chronic pancreatitis or cystic fibrosis, can lead to secondary diabetes because the insulin-producing cells are destroyed. Also, high-dose use of certain drugs, like steroids, can cause blood sugar levels to spike and lead to this type of diabetes. When the underlying cause is treated or the drug is stopped, the diabetes may improve or resolve. Monogenic diabetes. Monogenic diabetes is rare, making up only about 1% to 5% of cases. Unlike type 1 or type 2, it is caused by a mutation in a single gene. It is inherited and runs strongly in families. The two most common forms are MODY, maturity onset diabetes of the young, and neonatal diabetes. Because it's often misdiagnosed as type 1 or type 2, specific genetic testing is needed. The treatment is often often unique, with some people responding to specific oral medications instead of insulin. Latent autoimmune diabetes in adults. LADA. LADA is often called type 1.5 diabetes. It is an autoimmune disease, like type 1, but it develops much slower and occurs in adulthood, often after the age of 30. Doctors often misdiagnose LADA as type 2 because of the adult onset. Initially, the pancreas still produces enough insulin, so oral medication may work for a while. However, because the immune system is actively destroying the insulin-producing cells, the person with LADA will eventually require full insulin replacement therapy, just like someone with type 1. Brittle diabetes. Brittle diabetes is a descriptive term, not a separate diagnosis, and it almost exclusively affects people with type 1 diabetes. It refers to a condition where blood glucose levels are extremely unpredictable and volatile. Levels swing wildly and rapidly from dangerous highs to dangerous lows, despite careful management, diet, and insulin dosing. These dramatic, unpredictable changes require frequent, sometimes daily, hospitalization and make long-term management very challenging and stressful for the patient. Double diabetes. Double diabetes is also not a formal type, but it describes a patient who has both type 1 diabetes and insulin resistance. This is becoming more common. These people started with type 1, needing insulin because their pancreas makes none. But due to weight gain and poor diet, their cells also became resistant to the insulin they inject. They essentially have the autoimmune destruction of type 1 combined with the insulin resistance of type 2, making blood sugar management extremely difficult. Insulin resistance syndrome. Insulin resistance syndrome is a cluster of conditions often found together, including insulin resistance, high blood pressure, abnormal cholesterol levels, and excess body fat around the waist. It is sometimes called metabolic syndrome. This syndrome greatly increases a person's risk for developing cardiovascular disease, stroke, and, of course, type 2 diabetes. It represents a state of chronic metabolic dysfunction where the body's energy use and storage systems are highly impaired. Prevention and management. Prevention and management strategies vary by type. For type 2 and prediabetes, the best prevention is lifestyle, losing just 5% to 7% of body weight, eating a diet high in fiber and low in processed sugar, and getting 150 minutes of moderate exercise per week can often prevent or reverse it. For all types, careful monitoring of blood sugar, regular doctor visits, and medications, which can be pills, non-insulin injectables, or insulin itself, are the core of daily management.